Impulse control disorder, as classified under the DSM-5, is a behavior acted out in an impulsive manner which often results in self-destructive consequences. Pathological gambling is compulsive, uncontrollable gambling. People with pathological gambling are prone to develop general medical conditions associated with stress, such as hypertension and migraines. Those seeking treatment have high rates of suicidal thoughts and attempts, increased rates of mood disorders, ADHD, substance abuse or dependence, other impulse control disorders, and antisocial, narcissistic, and borderline personality disorders have been reported with those diagnosed with pathological gambling. Pyromania is the irresistible urge to set fires. It's usually deliberate and purposeful and occurs on more than one occasion. Tension or affective arousal can happen before the act. People with pyromania are usually fascinated with, interested in, curious about, or have the attraction to fires. They feel pleasure, gratification, or relief when setting fires, or when witnessing or participating in their aftermath. Kleptomania is the irresistible urge to steal. These objects that are stolen are usually of little importance and could have easily been paid for. Once they're stolen, they're usually given away or discarded. Trichotillomania is the irresistible urge to pull out hair from the head, eyebrows, eyelashes, arm hair, or anywhere else on the body. They often result in bald spots. Intermittent explosive disorder is a series of uncontrolled fits of anger or violence. These violent acts include physical or verbally attacking an individual, or destruction of property, and they have intense energy during the act and shockingly drop to extreme depression and regret after an episode. The diagnosis should only occur after only all the disorders associated with aggressive impulsive or behavior have been ruled out, such as conduct disorder, antisocial personality disorder, borderline personality disorder, a manic episode, or schizophrenia. Some causes through a genetic perspective is that there seems to be a genetic link tied to the onset of impulse control disorder. Studies have shown that children and teens who have family members that suffer from mental health disorders have a higher susceptibility of developing impulse control than in others. Some physical causes are said to be that there is a possibility that when certain brain structures that are linked to the functioning of emotions, memories, and planning become imbalanced, impulse control behaviors can develop. For environmental causes, professionals in the field believe that children who have grown up in families or in homes where explosive behaviors, violence, verbal abuse, and physical abuse were common are more likely to develop impulse control disorders. Some children and adolescents may unconsciously find that participating in such behaviors provides them with some sense of escape from the chaos around them. Symptoms from impulse control disorder may include aggression, acting out in a risky sexual behavior, stealing, playing with fire, lying, the presence of STDs in adolescents who are participating in risky sexual behaviors, burns on the skin of the children and adolescents who experiment or play with fires, or injuries resulting from physical fights. Also, they may become more agitated, irritable, and they become impatient, they have difficulty concentrating, and they become obsessed with the thoughts. Pyromania is more common in men. 20% of children who attended outpatient psychiatric clinics are said to have a history of fire setting. Kleptomania is more common in women. Out of the total of 6%, 3.8 to 24% of shoplifters were diagnosed with having a kleptomatic condition. Trichotillomania is more common in women. 0.6 to 0.3% of women and 0.6 to 1.5% are men. 80% of the total 2% admitted in hospital psychiatric services were men diagnosed with intermittent explosive disorder. Roughly 1 to 3% of the population are diagnosed with pathological gambling. The ratio for men to women is 3 to 1. Impulse control disorder can be treated through behavioral therapy. This is where they learn new habits to overcome undisciplined lifestyle that had led them to become addicts in the first place. For behavioral therapy, they try to modify the patient's behavior slowly over time. They build and strengthen the accepted social skills. They discuss the help by providing tips on problem solving. They look at the bigger picture instead of focusing on instant gratification, and they learn to curb impulse through self-discipline and self-control. In cognitive behavioral therapy, they focus on 3 major components, which are problem-solving skills, cognitive reconstructing, and relapse prevention. Common cognitive techniques are conducting functional analysis, decreasing positive reinforcement associated with impulse behaviors, and positively reinforcing non-impulsive behaviors. These two methods are usually successful. Psychoanalytical therapy is a one-on-one session with the therapist to view human personality that results from interactions between the conscious and unconscious factors. The purpose of this is to bring unconscious mental material and process into full consciousness so that the patient can gain more control over his or her life. The goal is to discover a patient's internal conflicts. Usually these attempts were not very successful,